I don't know if it works well. You have to tell me. Hi, my name is Lorraine. I'm 49 years old. Uh, I've had MS since I was 19 years old, and a condition called transverse myelitis, which is inflammation of the spinal cord, which I've had quite a few times. The major bouts that I've had have damaged my bladder and my bowels. And I've had asthma since I was at juniors, which has always been under control. I've always carried my blue inhaler with me, but I've never really had to use it. I have my red inhaler that I take twice a day. My blue inhaler, I've never really had to use it. Obviously, I was put as a priority to have my injections due to the fact that I have a very, very low immune system due to that, and all the medication I take and all the steroids that I've had over the years to do with my condition. Now, put in mind that my asthma has always been under control. About 4 weeks ago, I had my booster jab, and then 2 weeks ago, I was rushed into hospital with a major asthma attack. I was took into resus, where a anaesthetist was taking care of me and giving me the medication that I needed to open my lungs and get me breathing properly. At one point, I remember him saying that if my SATs didn't come up soon, that I would be ending up in the intensive care unit. As it was, they came up slightly. So after being in resus for many, many hours and being took care of, I was took to ward where I was there for 6 days, having nebulizers 4 times a day, my inhalers, very high steroids, of which I now have to carry a steroid card around with me because the steroids are very high. And I was there for 6 days, and now I've been told that my asthma is chronic. I now have a machine at home that I have to have nebulizers 4 times a day. I was on 2 different lots of antibiotics, and they they took very good care of me. But obviously, my concern is the fact that my asthma's always been under control. Then it just seemed that I had the booster, and it all went terribly wrong. It does make me think, because I've been watching some other videos of other people that after having the booster had more breathing problems. I mean, I've been told that I've got what they call long COVID because I had coronavirus last December 29th. I was diagnosed with it, and it took 7 weeks. I had to be put onto blood thinning drugs. I was constantly on different antibiotics. I was on hydroxychloroquine. I was on steroids constantly, oxygen, you name it. I think they gave me it. Obviously, because of my other illnesses, my immune system is shot due to a lot of the medication that I take. So it is very, very bad. Like I said, I've been watching videos lately. I'm one of these that if there's a jab that's going to help you, then have it. But the more I watch the videos of people that after having their boosters or their jabs are having breathing problems or long-term problems, the more it makes me think, is this boosters and that giving us more problems? The people that have low immune systems or have underlying illnesses, is it doing something to our system that like has enhanced my asthma after, I mean, I'm 49. I've had it since I was in the juniors, so 40 years. It's been under control, and then all of a sudden it just goes mental. It was very, very scary because I just could not breathe at all. I just could not even breathe in to take a breath. It was sort of like, and it was very, very painful in my back and that as well. The anaesthetist gave me so many different drugs, so many different drugs to get my lungs open and to get me breathing right. Now at home, I have a machine where I nebulize 4 times a day. And it would be interesting to know if there's anyone else out there that is like had breathing problems after having a booster. So yeah, so it's been quite rough after it. Yeah, I find the more I listen to other people, the more I'm thinking to myself, is this the right way to go with all these injections? I mean, my body's shot as it is. It can't take anymore. And then I'm having the injections to try and help me, but I feel that after my last one, it just made me worse. I just literally, my whole body just sort of give up. The doctor in the hospital on the ward said that basically he didn't know how I was coping with the fact that I have all the other illnesses, and then this came on top. And it was very, very scary. I'm someone who was always sort of thought what's wrong with me, always took the tablets that's been put in front of me, always listened to what my nurse said or my oncologist, sorry, or my rheumatologist, because I'm under so many different doctors. Sometimes I lose track of who I'm under. Yeah, I'm under neurology for my MS and my transverse myelitis, rheumatology for my fibromyalgia and my arthritis, and for my osteoporosis in my spine. Then I'm under oncology because of my blood disorder. I sort of lose track of who I'm under sometimes, and now I'm under respiratory because they said it's something that's not going to go away. I'm going to have to continue to have the nebulizers at home, have steroids on standby. At the moment, I'm on, like I say, a very high dose. I carry a card with me, an emergency card, and I take a lot of different medication, a lot. I take gabapentin, baclofen, amantadine, amazepine, quinzepine, a hydroxychloroquine, prednisolone. I've just finished my last of my antibiotics. I always take vitamins. I take vitamins every day. I also take a vitamin D with calcium for my bones, and I always try to eat healthy. I eat a lot of vegetables and fish, and I don't eat red meat and stuff like that. I just prefer fish and vegetables and fruit and stuff like that. So I try to keep my body as healthy as I can. I tried to do some fitness stuff, so, and I've been looking into stuff that will try to help my lungs. Like I'm going to start going swimming when we can. I done like a little bit of training today, self training at home, and so I tried to do a lot of stuff that will help me. But when I got took in a few weeks ago, that was so scary because I literally I just could not breathe. It just did not matter what position they put me in, what they did, even with the oxygen and everything on. It was just like my body just did not want to know. And then I was in resus many hours. And like I said, it was an anaesthetist taking care of me, because he turned around and said that if they needed to take over my breathing, obviously he was there to do it for me. Which is quite scary when you have a doctor turn around you and say that if your SATs don't come up soon, then they're going to have to take over your breathing for you. Like I said, I had coronavirus 29th of December last year, and it was quite bad. I had it for 7 weeks, and I was in that hospital with it. There were times when I just could not take a breath. There was one time I got took in because it literally felt like somebody was stabbing me in the back, and my calf was in a lot of pain, and they ended up putting me onto blood thinners. So now I'm waiting to see the respiratory doctors. The doctors that I saw on the ward were respiratory doctors, and they said that this is going to be lifelong now. That if my nebulizers aren't working at home, I am to just call the emergency services straight away, because it just means that my lungs aren't opening properly. I was bringing up, it sounds horrible, but a lot of white webbing. Every time I coughed, it was like there's loads of stuff coming up. So yeah, it was quite scary, because I think I had an infection as well. That's why they put me on like the 2 different lots of antibiotics. They were giving me injections in my stomach, obviously, because you're in bed. I think it's to prevent blood clots, anything like that. So yeah, it's been wow, a rotten 13 months. I lost my husband last year, November 24th, and my brother same day. And then my auntie 6 weeks later from coronavirus. Then I had coronavirus, and obviously we had to stop anyone coming into the house, but then I was took into hospital. Like I say, then I had my jabs, which everybody advises you do. And then I had my booster, and then my body just started fighting against it. It just really didn't want to know. Yeah, I just started off with like a cough, just like coughing, and it was going for days. I just didn't get a break from coughing. I have a SATs machine anyway, so I was checking my SATs, and at one point they were at 83, which I know is low. So I went to the hospital, to the walk-in centre. I didn't go to A&E. I went to the walk-in centre to see if they could offer some help or whatever, and they took it straight away, and the nurses done my SATs and everything, and they straight away called over for the resus team that come and got me and took me into resus, which was scary. They were really good, really great doctors, but it just makes me wonder, is it the fact that I had the booster that made my asthma go haywire? I mean, it's not good having to 4 times a day use a nebulizer, and obviously different inhalers now to keep things under control. I find just walking up the stairs, I get very out of breath. And I find that since I've had it also, with my MS, I've found that the palms of my hands and the soles of my feet are constantly buzzing. It hurts me to walk anyway. I get like electric shocks through the bottom of my feet all the time. But I found since I've had it, I've got constant buzzing in my hands and the soles of my feet. I go to neurology on the 6th to see my neurologist. So I'm going to mention that to them. And another interesting thing. Now, I don't know why they would ask this. When I was in hospital, and the doctors were checking my chest and things like that, one doctor found a lump in my right breast, and the colour of my left breast, and the colour around one side has gone like reddy colour. Now they got me an emergency appointment for the breast clinic called a HOP clinic, which I went to last week, where they did a mammogram and an ultrasound straight away. And I went in to see the doctor, and I don't know why, but the doctor asked me which arm I had my injection in. Was it my left arm I had my injection in? Obviously, and it was my left breast that's gone red and had the lump. Now, why would they ask you that? Why would they ask you which arm you had your injection in? What would that have to do with having a breast lump and the fact that your breast has gone like a bit red? So, is it something they know that we don't? I mean, she said to me that they're called lipomas, that's in my breast, and the redness. She said some women get it, but they are going to keep an eye on it. But when she asked me which arm I had my injection in, I was like, what? Why ask which arm I've had my injection in? What's that to do with my breast? It makes you think that they know something that we don't. Yeah. So, like I say, I was watching this woman earlier. This is why I've come on, because I was watching this woman earlier, and she had exactly the same after her injection. She actually started the day of her injection. She has a low immune system, and her breathing started getting quite bad the day after her booster. She ended up going home, going to bed, and sleeping all night. And then she actually ended up in the hospital because her larynx were closing up. And she's had a very, very rough time of it. And it just made me think, right, well, asthma's been under control for 40 years. And then all of a sudden, I have a massive attack. And then they turn around and tell me that I got CPOD as well. And that basically I'll be on in nebulizers and everything for the rest of my life. I've never smoked in my life. Never. So my lungs should be, in a way, should be perfect. I've never smoked. Obviously, I've had people around me smoking, but I've never smoked. And it's just, my eldest son is very like anti-vaccine. He's just like, he looks into everything and he's like, Mum, don't have it, don't do this, don't do that, and I'm like, well, no, we've got to have it because we've been told we can get worse and things like that. And now it makes me think, when I'm watching these different videos, is he right? Is there something in it that if you've got low immune system or you've got an underlying condition, which I've got many, does it enhance those conditions? Does it trigger your body to enhance your conditions? What's wrong with you? I had it personally, although I'd had coronavirus. I then had my injections and my booster to keep everybody else safe. What I thought was keeping everybody else safe. And as it works out, it just made me worse. So, yeah, but I would be interested to know if anybody has had the same sort of problem, really. Well, any problem with it in the way of breathing and if you have any underlying problems, did it make your problems actually worse? Did you find that your symptoms from your conditions are worse? And things like that. Sorry, you can see my eyes half closing. I've been like having headaches for a couple of months now, on this side, and my eye is just it's just closing. I just don't know what's wrong with it. I'll see neurologists and ask them. But yeah, so I think in the family, it's me and my daughter that's had the jabs. My sons won't have it. They don't believe in it. They're just like, they think it's worse to have the injection than not have it. I did ask them to have it, obviously not only to protect me but to protect them. But obviously they're adults now, so I can't make them have it. So yeah. So it would just be interesting to know if anybody has had any reactions in breathing, if you've got neurological problems, if it's made them worse, if you've got asthma, if it's made it worse, or really anything. If anybody could just sort of let me know. Okay. Thanks a lot.